Hello, good evening, everyone. It's 8 p.m. UK time. So, as you know, it is time to start our live event once again. It's good to be back once more. And we do have an interesting topic, definitely different topic from compared to yesterday's topic. So, I'm very, very happy that, Dr. Anna was able to bring this topic to us. And as you can see, this is Dr. Anna Voskuilen. I hope I have said it correctly. Thank you. And thank you already for joining us tonight, Dr. Anna. And how are you feeling tonight?
Very good. And how are you?
I am very happy that you are with us. That's for sure, and I'm really excited to, as I've mentioned, to have this topic tonight. And let me just mention that Dr. Anna is the specialist in obstetrics, gynecology, and reproductive medicine at Fertty International. And the clinic is located in Barcelona, Spain. So we are connected to Barcelona tonight. And as you can see, the topic I've mentioned is definitely a very interesting one, and it is ovarian rejuvenation is PRP, a way to stop fertility ticking clock. And Dr. Anna has prepared a presentation on this particular topic, and after her presentation it will be time for your questions. So as always, all you need to do is just put the questions in the chat section, and after the presentation Anna will definitely answer all of your questions. So don't hesitate, just whatever's on your mind, go ahead and type those in. And remember that we are here every single day from Monday to Friday, as we definitely want to give you this opportunity to meet some fertility experts, fertility coaches, some acupuncturists, anyone that can actually help you out. And as you know, all those events have been brought to you also thanks to our ambassadors and partners. And you can see all of them as a bunch of people that is supporting this Stronger Together initiative. So thank you for that. And I believe we do can start with the presentation, right, Dr. Anna?
Perfect. Thank
Wonderful.
you, Caroline. So I'm Dr. Anna, as Caroline said, and here you have our website of Fertty International and our mail in case you want to contact us. And well, tonight's topic is ovarian rejuvenation. As Caroline already said, is PRP a way to stop fertility ticking clock? So the first thing that I have to say is that we are not doing that in our clinic yet because there's not enough evidence. But I think that's a very interesting topic, and because it's related with ovarian rejuvenation, I wanted to talk a little bit about it tonight. So let's start with the presentation. First, I will explain a little bit about fertility and age. So we know that women are born with a certain ovarian reserve and that the ovarian reserve decreases with age. And the decrease becomes more important after 35, 37, 40 years and is accompanied by a decrease in terms of oocyte quality. We also know that the numbers of follicles decreases until menopause, when up to 1,000 follicles could still be in the ovaries. And we know that we can test the ovarian reserve, but not the oocyte quality, okay? And we know that the oocyte quality is related to age. And after 40 years old, because of this decrease in oocyte quality, there's a difficulty in getting pregnant, a higher rate of miscarriage, and more chromosomical abnormal embryos. And what can we test? We can test the ovarian reserve in numbers. And how can we do that? We can do that with some blood tests like the FSH and estradiol, which are done in the beginning of the cycle. We can also test the AMH, again with a blood test, with a blood sample. And this hormone is the anti-Mullerian hormone, is produced by preantral and antral and small antral follicles. And this one doesn't vary inside the cycle, so you can do the blood test whenever you want. And at last, we have the ultrasound, in which we can do an ultrasound follicle count. So what we can see are the follicles that are in the ovaries. Those follicles have a little bit of liquid inside, and that's the reason why we can see them. And those can be stimulated and grow and produce a major oocyte. So A little bit about follicle development. So what we know that it happens normally is that in a natural cycle we have this number of antral follicles in each ovary, and all of them could grow, but we don't have enough hormones for all of them to grow. And generally, one follicle grows and we get one egg, and we ovulate just one oocyte, and that's the reason why people normally have babies one by one. And what do we do with IVF? So with IVF treatments, we can use the antral follicles that we can see, those that are available, and make them grow in response to a treatment with hormones and try to get mature eggs. So until now, nothing has proved to help us increase the number of antral follicles, so the basal ovarian reserve parameters, since it is related with this total amount of the ovarian reserve, and because this growth of the follicle has an initial preantral phase, as you can see here in the picture, and that phase is independent to the hormones that we can give. And while the development of the follicles before the antral stage is still not well known, not clearly understood, there are some hypotheses and some signals that have been studied, but clearly we need to make more research to understand it clearly. So ovarian rejuvenation, is it possible to increase ovarian reserve parameters? Well, ovarian aging, what do we know? We know that in an older follicle, the problem is that there's a decrease in DNA repair, problems to make the division and distribution of the genetic material, and that there is also an ovarian hypoperfusion, a lower blood supply, which makes it more difficult for the oocyte to repair or mitigate this microstructural damage that it could have. And the ovarian rejuvenation technique should not only increase ovarian reserve parameters, but also the quality of the oocyte, because the main goal that we want is achieving a full-term pregnancy, achieving to have a healthy baby, a live birth. So what we know now is that there are some different techniques that are being studied for the moment. One of them is the PRP treatment, the platelet-rich plasma treatment, which we are going to explain tonight. But others are the stem cells infusion and ovarian rejuvenation surgery, which is achieving a molecular activation by the fragmentation of the tissue. So what are platelets? Platelets derive from megakaryocytes, which are big cells that in response of different stimulating factors, they release little portion of cytoplasm. So the platelets are nucleated cells created from the megakaryocytes and have different functions. One of them, the most known, is the first response to in hemostasis. And they have also roles in tissue repair, neovascularization, and immunomodulation. And all these functions are achieved due to the granules that are in the cytoplasm, which contain different growth factors and that will be released in response to some tissue damage and others. So PRP treatments, what do we know? We know that PRP injection has already been used in other fields as traumatology for tendinitis, arthritis, dermatology for hair growth, healing of bones, odontology as well. And what we know is that platelets produce different growth factors. Here you have a list of them, cytokines, growth factors, and all these can produce cell migration, cell differentiation, proliferation, activation of angiogenesis, which means activating the formation of new vessels, and tissue regeneration as well. So knowing that, some authors have thought, okay, would be a possibility in ovarian rejuvenation. So could we indicate it in some kind of patients, like, for example, poor ovarian responders or premature ovarian insufficiency, perimenopause or menopause? Could that be possible? So the first thing, before going to the evidence, I will explain a little bit how the procedure would be. So the methodology varies between different groups. Some of them say that they take a blood sample of 20. Some of them take more blood sample, a bigger blood sample, and they prepare this blood sample with centrifugation and adding some activating products. As you can see in the picture, after centrifugating, there are 3 phases in this blood, and the middle phase is the one that has a bigger concentration of platelets, and this is the plasma-rich platelet. Platelet-rich plasma, and they take this part of the plasma and they do an injection of it in each ovary, more or less between 2 and 5 milliliters in each ovary. We know that this is a procedure similar to the oocyte retrieval. It's ultrasound guided and done, with or without sedation, and it lasts more or less between 7 and 15 minutes. And the injection is done in multiple sites so that all the layers of the ovary are exposed to it and more in the cortex. And after that, they control vital signs, and then they discharge the patient when they see that everything is correct. And after that, they control the ovarian reserve parameters during some months. And in some cases, they do IVF as well, and they see how it goes. So what would be the hypothesis? So can we increase numbers and quality of eggs? So the hypothesis would be that the PRP can help activating preantral follicles or early antral follicles. And what the study seems to show, I will tell you in a few minutes, but it seems that in some studies it could show some increase in somewhat, but in some cases, and actually the quality would not change because the main outcome would not change, the live birth rate. So this is very important to know. But some authors hypothesize that it could improve the oocyte quality through the following. As you can see here in the picture, it's a little bit small, but you can see it here on the left. Platelets could produce and release some cytokines and growth factors, and increase the vascularization, decrease the hypoxia of some follicles, and make a delivery of genetic regulatory signals to some stem cells that can be in the ovary or to latent senescent oocytes and wake them up. And with this, do a follicle recovery. That would be the hypothesis of some authors. So what's the evidence? Well, first, in 2016, Panta's group reported some cases in which they had used the PRP. And after that, some papers have been published telling some case reports. So that means that they are telling some cases in which it has helped or given some pregnancy. But of course, we need more evidence because you don't know in that kind of papers, you don't know how many patients have been treated till this moment to get one pregnancy or one live birth. So what we need is randomized controlled trials, which means big samples of patients, dividing it into groups. One would be the control group and doesn't receive any treatment, and the other would be the part that received the treatment. And after that, we would be able to compare both groups and see if it really increases or not the outcomes. So I will go now to explain some of the last papers that I have seen. One of them is that a case report of Marzi Farimani, in which they had 23 poor ovarian responders between those ages, 34 and 40 years old, and only 19 of them had the PRP, and only 11 did the follow-up, and they report one live birth. But again, what I say is if you cannot compare to another group, you don't know if this could be just a matter of chance, the chance factor, okay? And also because those patients are between 34 and 40 years, so it could be something related with chance and not with the PRP injection. This other paper Also, there's a perspective here. We can see a prospective pilot study, a controlled trial. So this one is a controlled trial, actually. And what they did is in 40 poor ovarian responders, again, poor ovarian responders before IVF, with this range of ages. They had 20 controls and 20 patients who underwent the PRP treatment. And the results were that a statistically significant and clinical pregnancies and live birth rate was not found, and neither in AMH, FSH, and antral follicle count. But again, they say that the number of patients used here is insufficient to make a concrete conclusion. So they say the same as us, so that we need more randomized controlled trials. Another study that we have here is a non-randomized controlled trial when they did it in patients with low ovarian reserve. 46 patients had an ovarian PRP injection and 37 had no intervention. And here they show some significant improvement in FSH, AMH, and antral follicle count. But again, no differences in the rates of first trimester miscarriage and live birth between groups. So again, the quality seems not to be affected. Here we have another study in which we have 311 patients that had premature ovarian insufficiency, but it's not controlled. So what they did is in these 311 patients, they did the PRP injection, and some of them were spontaneously pregnant. And actually, some of them had a live birth or sustained implantation, which means more than the first trimester. But actually, in this kind of cases, spontaneous conception in women with premature ovarian insufficiency is reported between 2.2% and 14%. And here what we see is a 7.4%. So again, we don't see an improvement related with doing nothing, okay? And the patients that were not pregnant, some of them did the ovarian stimulation. 201 patients did the ovarian stimulation and had retrieval, and 82 had the embryo to transfer or to storage. And of 55 patients that did the embryo transfer, the rate of pregnancy was very low. Live birth and pregnancies were very low. It's 9. So yeah, again, we see not a very an increase in the main outcome. What they saw is that the antral follicle count increases in a statistically significant way as the AMH, but actually, as you can see, the increase is very, very little. Okay, so we still need more evidence. These authors actually they said that the problem of their study was that they have no independent control group, as I already told you, and they don't know if these spontaneous pregnancies or these outcomes could be due to a mechanical damage or because of the PRP. Okay. This about the mechanical damage is based on other kind of ovarian rejuvenation techniques like surgery. And at last, we have this recent published paper. It's a prospective observational cohort, and they have 4 pilot studies. So they have poor ovarian responders in one of them, premature ovarian insufficient on the other, perimenopause and menopause, and they did a 3-month follow-up. And they looked for some outcomes of ovarian reserve, okay, and they saw an increase in ovarian reserve parameters. They reported some live births, but again, they say that there was an heterogeneity of results, and it is not clear which patients are going to respond and which not. And actually, we need bigger samples of trials with bigger samples of patients, controlled, and to see more if we have really an evidence on that or not, or if it's just something that we are seeing. So our conclusions would be that the use of autologous platelet-rich plasma has to be considered as an alternative and experimental treatment option for the moment. Some studies, it seems that it increases the ovarian reserve parameters, in others not. And it is not clear in which patients it could be useful and how much, if it's really useful. Most of the studies show no differences in terms of quality of the embryos and also in live birth rate, which is the main outcome that we need. And well, there is more evidence and clinical data needed, consisting, as I already said, consisting in randomized controlled trials, big samples of patients, and with this we could see which patients will benefit of this, how does it work, what are the mechanisms, of course, if it works, and are there adverse effects. We need to know if there's a long-term safety and which methodology would be the best, what's the procedure of preparation, do IVF or not, when, and how many times of PRP. So the question actually is, does it really work? Can we rule out chance? And is it going to increase the main outcome, live birth of a healthy child? So our position is that we need more information based on big sample randomized control trials. And since there's still a lack of evidence, we don't apply this procedure in our clinic, and as most of the clinics, almost all the clinics. And first, we need to guarantee safety and efficacy before adding it into the clinical practice, of course. And yeah, for the moment, egg donation or previous egg preservation are the most effective options. And yeah, unfortunately, we cannot offer other treatments if we don't have the evidence. So it's very interesting to continue looking at it and to do more studies on all these ovarian rejuvenation techniques, because it could be something that provides our patients with more probabilities or more possibilities. And well, the last thing that I want to say is about COVID, that we are open, we are working, fully working, of course, following all the government recommendations and what the institutions are telling us. And we are ensuring safety for our patients and quality in all the procedures that we are doing. Okay. And well, thank you very much. That was all for tonight for this topic. I don't know if we can
Wonderful.
go to the questions.
Wonderful. Thank you so much for bringing this topic and for the presentation, for explaining how it works. And of course, yes, you are right. There are plenty of questions ready, actually. And
Well,
yes, we can get to them right away. And
perfect.
let's add the first question. So, what are the costs for PRP treatments?
Well, I cannot answer this question because we actually are not doing this PRP treatment, so it's something that I cannot answer. I'm not sure if it's really very expensive or not. I don't think so, but of course I cannot tell you that since we are not doing it.
Of course, that's understandable. So thank you for your question, of course, as well. And next question. So, what are the appropriate age for that kind of treatment?
Okay, so actually, as I already said, there's no clear evidence on that saying that PRP is going to help. But based on other ovarian rejuvenation techniques, it should be under the age of 40 years old normally, because we think that the oocyte quality is not going to improve. And then the outcomes of that we want to achieve, the live birth, is not going to increase in patients that are more than 40, 42 years old, because the equality is not going to be better. So that would be more or less the idea. But I know that some studies, some papers have reported live births with more than 40 years or even more than 43, I think.
All right, wonderful. Thank you so much for that explanation. Next question is also right here. So, can PRP allow a 55-year-old woman, menopausal woman, sorry, to produce a good egg that is not unemployed, so she can have her own genetic baby?
Well, yeah, again, it's really a good question because yeah, we're all thinking about that. Again, the answer would be more or less the same. So since we know that the rate of aneuploidy increases with age, and that we know that above 40 years old, it's very 43, sorry, or 44, 45 years old, it's very difficult to have a good quality egg that gives us a euploid embryo. Knowing that, of course, again, I think that with 55 years old, it would not a good possibility. Uh, Basing all this in the papers that I have seen, of course, we need more information, and we need to do more studies on it, and to see how it goes, and to make big trials with a bigger sample, and to see if it could increase or not the egg quality. But for the moment, it's something that it's not clear. So after the age of 43, 44, it would be very difficult.
All right, of course. Thank you so much once more for yet another question, and of course for your answer to that. And well, what is the success rate after the treatment? Anything you can add?
Well, yeah, that's the good question. Actually, that's the question that everybody is looking at. So all the papers, all the authors, the doctors that are doing research on that, what they want is to know if it really is something that can be effective with patients, and with which patients it could be effective, and what would be the success rate. That's the main question for everybody. So for answering that, you need a control trial, because you need two groups. You need to control the one, to see what happens in the control group, and then to see what happens in the patients that are being treated, and then you can compare the effectiveness. You can see if it really is going to increase the success rate, and how is this success rate. But again, since we have no more information, what we need is to do more studies on it, and more big trials, randomized control trials, and look if there's something that we can see.
And excellent. Thank you so much once more for that. And of course, let's have a look at the next question. And can PRP be used to relieve symptoms of early menopause before 40?
Yeah, I've read also some papers about that, but actually, yeah, it is something that it's still experimental, and that doesn't seem to have an evidence on this kind of use. I think it's better in that case to think about hormonal therapy replacement. So because it can be also very safe, and it can be also very controlled, and also because maybe if PRP injection could have an effect on these symptoms, if it had it, it would be something temporarily. So also we would not know if it's for, I don't know, it lasts for 1 month, 2 months, 3 months, maybe. I'm talking without knowing if it really helps to relieve symptoms. But if it helped in that cases, maybe it would be something that lasts for 1 month or 2 months. So it's something that I think it's not worth it to be doing that all the time.
All right, once more. Thank you so much for this again. All right, next question is up. Is there any side effects of PRP?
Okay, so that's also a good question. Till now, they have not seen important side effects, but I have to add that, of course, since it's something that is starting to be done now, we don't know if there are long term side effects. But the side effects that can that have been reported is some bloating, some pain in the ovaries. Of course, it could be also side effects related with the injection of the with the procedure of the injection, as the same as with an oocyte retrieval, like bleeding a little bit or infection. But till now, no other side effects have been seen.
All right, that is good to hear as well. Thank you so much for that. Okay, next question is also ready. Any information on blood type of patients where it has increased the diminished ovarian reserve parameters?
Um, so the question, I think, is if blood type is going to change this response to the PRP. I think that's the question.
I
If that's
believe
the
so. I'm not really sure, to be honest. Okay, so if it's not the case, just please type it in. Okay.
exactly. If that's the question, I think that there's no information on that. So I think it's not being studied till this moment. If there's some differences between the blood types of patients, not that I have seen in the papers that are published.
Understood. Again, thank you so much for this then. And actually, next question, you have mentioned this. Sorry, there is, sorry, I'm just checking if there is a follow up, but next question is from the same patient. So you have mentioned this. Are you doing any of this type of research at all at Ferty?
So we are not doing it for this moment since there are no evidence of that. But as soon as there's evidence on that, we will be happy to introduce it in our protocols. But first, the main important thing is to see if it's really effective or not, and if it's safe, of course. And after knowing more information and having evidence, then we could add it in our protocols, of course, but for the moment we are not doing it. We will be following these studies and seeing if something else is published, of course, but for the moment we are not doing it.
And once again, thank you so much for that clarification. Next question is, so where in the ovary do you inject the PRP, in the follicles or stroma?
So actually, some papers said that it was in all sides of the ovary. Some others said that it was more in the cortex of the ovary, where more follicles are there. And then the thing is to activate those follicles that could be senescent in those places, more in the cortex, of course. And what they explain is that they introduce the PRP, but in all sides of the ovaries. So they inject it from one side to the other side of the ovary, retracting carefully the needle and while injecting the PRP. So that's more or less how it is done.
Again, wonderful. Thank you so much for that. And we will go back to the previous patient, okay? There is a follow up, okay? The question was whether you are doing research in general at Ferty or not necessarily this one.
Yes, of course, we are doing research. We are doing some things on it, but not this one.
All right, thank you. Sorry, just checking. Of course, there are more questions coming up right here. Next one is, so do biosimilar FSH drugs have the same effect as the human hormone? What is the difference in the result?
Mm-hmm. So that's a good question, actually. When you use other drugs, what you want is a little bit to improve what your body does normally. So actually, what you want is to have, as I already said, you want to achieve a higher number of follicles, of course. And actually, the FSH that is used is actually what we look is to have the most similar FSH to the one that we have. There are some FSHs taken from urine, purified urine, and some FSHs that are done genetically. So we have different kinds, but all of them are being used, and we know that all of them can help in this IVF process or in this stimulating process. It's also something to take into account that there are different kind of stimulation protocols. So you have protocols with FSH, protocols with FSH and LH, other protocols with FSH and AMH. So of course, we always use different drugs and different protocols, and what we need is to increase as much as we can these results in our patients.
All right, once again, thank you so much for yet another interesting question indeed, and of course for your answer to that. And if you can take a look at this, on what day of cycle is PRP injection in the ovary recommended?
Okay, that's also a good question. So when they did it in patients without menstruation, in patients like menopausal patients, they did the injection in any day, of course, because there was not a cycle. But in patients with cycles, they normally did it in the beginning of the cycle. In the first 10 days of the cycle, they did this injection of the PRP.
Excellent. Once again, thank you so much for that. And of course, there are more questions coming up. So I have read PRP has been used to help thickening endometrial lining. Is it more common use now?
Yeah, actually, it's something that is being studied also. Still, it's something that also needs a little bit more studies. And now it's maybe it's starting to be used, but again, I think it's not. We don't have a strong evidence on that. So yeah, it's not something that is being commonly used, I think. But I'm not sure about that because I don't know how it's being used in with endometrial lining. I know that they do it in injection, and then some days after they repeat the ultrasound to see how it goes. But I really didn't go inside this part of the topic, inside the endometrial lining, which is also a very interesting topic. It could be a topic for another day as well. And so I don't know if I have answered your questions, but again, yeah, I've gone more through the part of the ovarian rejuvenation.
All right, wonderful. Once again, huge thanks for explaining this as well. And more of those questions coming up. So does PRP improve equality?
Okay, so yeah, that's a very good question. So for the moment, it doesn't seem to improve the equality, but it's something that we cannot say for the moment because there's not strong evidence on it. So what we need is, again, what I say is to see if it's really going to increase the quality of the embryos that we can have with PRP, or if it's going to increase the main outcome, the live birth, because if you increase the live birth rate and you decrease the miscarriage rate, then you can see also that there's an improvement in equality. But we still need a little bit more studies to see if it is really going to improve the equality.
And once more, thank you a lot for that. Okay, and actually, there is a follow up from a different patient, but actually, in which other ways can I improve equality? If you can
Mhm.
advise.
Yeah, that's also an interesting topic. So There are some different kind of protocols that can be used in order to try to improve the egg quality. Kind of protocols during the stimulation. Also, that can be maybe some supplements, some vitamins that you could take, like melatonin or CoQ10. But it's something that's also being debated. In the protocols, sometimes some testosterone can be added before, or DHEA, but there are still we still need more studies to see in which way we can offer the best option, to the best kind of improvement in equality. A lot of the options are being debated, and we still have to do a lot in this topic.
All right. Again, thank you for that. And let's me have a look. As you can see, more and more of those questions are coming up. Next one is something that I'm not sure. So sorry. Have you heard on Amplaf? Is it better than PRP? I'm not familiar with that. Sorry.
Yeah, me neither. I'm sorry. I don't know what NPLAV is. Maybe yeah, I could look at that, and of course I will look at that, and maybe I can give you an answer, and I can write you a mail or something.
Of course. Understood. That's not a problem. I am able to always forward this, and of course we that can be checked. Yes, and Dr. Anna will be able to get back to you. We can do that for sure. All right. Um okay, next question is up. So I use melatonin as a natural substitute to PRP. Did bring my menses back. Do you know anything about the use of melatonin to reverse menopause? Do you know if melatonin affects the thyroid function? Thank you.
Well, I know that melatonin is being used as an antioxidant, which is a very strong oxidant, and thinking on that, we try to use it, or we're starting to use it, trying to improve the egg quality. In terms of bringing the menses back, I don't know if it's something that it is going to help. Again, the thing is that comparing it to PRP, I don't know if PRP would be a good option also for having the menses back in some cases. Of course, it depends on each patient, because if you have a patient with 45 years and that has problems with the menses starting the perimenopause, that's one thing, and the other thing is very different when you have a younger patient, and you also have to look at a lot of things. So you have to make sure that there's not other factors that are affecting your cycle, your menstruations. So we have to check the thyroid function, the prolactin, and other things, of course. Make sure that everything is correct, to make sure that there's not another cause of the amenorrhea. But yeah, in case of reversing menopause, I don't know if it's useful. It's something that I've not checked.
All
But I,
right.
I think it would not be something to think um, on when you think about reversing menopause. I don't think it's something that it's going to help.
All right. Again, understandable, of course. Thank you so much for that advice as well. All right. Next question. Can the results of PRP be replicated other ways, like through diet, keto diet?
Well, actually not, because what they do in PRP treatment is try to use all these cytokines that the PRP that the platelets had inside, to use these cytokines, these growth factors that are there, that can regenerate in some way the tissues. So that's what they think that is going to help. So I don't think that maybe with the kind of diet, of course, diets are very important to try to improve general health, and some kind of diets could help in improving outcomes. And But again, I'm not sure, because one thing is the use of the platelets, which uses all these cytokines and growth factors, and the other thing is this diet. So I don't think it's going to bring the same actions as the PRP cytokines and growth factors.
And excellent. Once again, of course, thank you so much for explaining this as well. There are like 3 questions left, so we will be slowly finishing, okay? But of course, if you have any questions left, go ahead and type those in the chat section. Okay, next question is also right here. Are you familiar with any therapies which can help up 50 plus women conceive using her own eggs, reparent IVF, OVA science type procedures, physically removing stem cells from the ovarian cortex, etc.?
So in this case, with a woman with more than 50 years, as I said, I think it's very difficult to know if we can improve the egg quality with ovarian rejuvenation techniques. We still need some studies to see if it's something that we could do or not. Till this moment, in case of PRP injection, we don't see an improvement, or it doesn't seem to improve the quality. And what we know is that with more than 44 years, 45 years, um, almost all the embryos that are created are aneuploid. It's very, very, very difficult, I'm sorry, to have an euploid embryo with that ages. So actually, I think that in other ovarian rejuvenation techniques, I think that for the moment they know they have the same information. So it seems that it's not going to improve the egg quality, and for that reason, it would be something that would be very difficult above 45 years old.
And excellent again. Thank you so much for that. Let's have a look, of course. Oh, sorry, there is a follow up. Okay, so let me go straight to that. He wasn't talking about PRP. Was asking about other therapies such 3-parent IVF. If you've heard about any other options.
I've heard about other options that were done before, like ooplasm transference and mitochondrial transference, but it's something that has stopped because someone had problems with malformations with babies. And in terms of mitochondrial transplantation, I think there were not high evidence that it was something that was working. But I'm not sure about that because I haven't looked at that. So that's also a very interesting topic, actually, which we could look at, of course.
It's still something that is being researched, yes, of course.
Mhm.
We just need to wait for some more evidence, I guess, as well, right?
Exactly. It's a very interesting topic because I think that there's a lot that's being done at the moment in ovarian rejuvenation techniques. And it's something that's very interesting to study, because it's very frustrating when you as a doctor, you have your patients and you cannot offer a good option with own eggs. It's very frustrating for the doctor and also for the patient, of course. So I think it's very interesting to study this, and I think that a lot of studies will be done on ovarian reserve, and actually are being done in ovarian rejuvenation techniques. And so we will see. We have to wait a little bit to have more evidence on all of them.
That's true. Thank you so much for that, indeed, as well. All right. And you have mentioned this, okay? But if you could repeat what you mention. So, what is the live birth rate for women who did PRP?
Yeah. So actually, is what I said. It's a very good question because what we need is more evidence on that. So we need to know if it's really going to improve the live birth rate, because all most of the studies that we have are studies that are not randomized controlled trials, so we cannot compare both groups, the group that hasn't had the treatment and the group that has had the treatment, to say, okay, let's see how the outcomes are. Is it going to increase the outcomes? And what's the live birth? Can we see actually a live birth rate related to the PRP treatment, or could it be related to some chance in some cases? So what we need is to do more studies, more randomized control studies, to see if there can be differences, because this is the main outcome that we want, the live birth, of course. So yeah, we need more evidence on that to see if it's really going to help, and in which patients it could help or not, how to do it. So we need more investigation on that.
Of course, thank you so much for the clarification once again to this one. Okay. Um, Sorry, next question is also right here. So, what do you think PRP treatment for ovarian rejuvenation combined with nicotinamide, sorry, adenine, I'm not sure, sorry, here, could improve the quality and number of antral follicles, I believe?
So I'm not sure about that. Really, I think there's no evidence on that again. So I cannot tell you an answer if it's going to improve the quality and number of antral follicles. Yeah, it's something that we have to study. All these things should be studied, and we should think if it's going to help our patients, if it's really effective or not. But unfortunately, I cannot answer you this question because it's something that I don't know if it could help or not.
All right, of course, understood perfectly. Again, thank you so much for, well, for that question as well, though.
Yeah.
Okay. Next question is also definitely interesting. Have you heard on IVG? When do you think it will be available?
Well, I'm not sure when it will be available. I think that what you're telling is just creating some gametes in vitro. Is that right? I'm not sure
And
if
again, if
it
you can clarify, yes, that would be perfect. So I'm sure Dr. Anna will be able to answer you. Just let's give it a minute and see if there is
yeah, I see that someone is
someone is
typing.
typing. Yeah, we need to wait a bit. And in the meantime, we can just go to the next question, okay? Because and we will be able to go back. Um, Perhaps you know. So this is interesting. Thank you. I would like to remain informed with regards to these techniques and their implementation, and also more research about it. Would you kindly indicate a link where we can remain updated? Is there like a research option to like a page website? Do you know about it?
No, I don't think there's a page or something that they can look at. Yeah, but I'm not sure. I don't know if someone has created like a website or anything related with PRP. But of course, we can be in contact or in touch. Sorry, if they want to have some information, I can give what I have seen, and maybe they can have more information knowing that.
That is indeed true. It's also hard for me to suggest anything at this point, I'm afraid. But of course, um, we are definitely here to update you, and we are definitely going to have another webinars on that. And I'm so stay tuned. I can only say stay tuned, because this is something that is being researched, and I'm sure in sooner or later we will have some more evidence as well on that.
Yeah.
Security.
Mhm.
All right, excellent. Thank you so much. And well, there is not a question here, but there is a comment. Couldn't agree more. Hopefully, in a few years, there will be some proven ways to stop the fertility clock ticking.
Yeah, actually, hopefully, yeah, because it's something very, very interesting, and it's something that we need to offer to our patients. Since what I said before, it can be very frustrating when you want to help patients, and you're not able to help them with their yeah, their fulfilling for family. So well, it's something very interesting. I think that, as you said, Caroline, is something that is going to be studied now a lot, in all different kind of techniques, in ovarian rejuvenation. So yeah, we will see in a few years how it goes, because we are seeing that technology and biology and all the studies goes very quickly. Everything is giving us so a lot of information, and I think that maybe we will have hopefully some ways to stop this fertility ticking clock. Yeah.
Of course, couldn't agree more here, as I mentioned. Thank you so much. And in the meantime, one more question has shown right here. So let me go straight to that one. Definitely an interesting as well. I
Mhm.
am a 33-year old and already in menopause. 1 month ago, I did PRP. My menses are back, and I can also notice some more changes in my body. Do you know
Mhm.
for how long the effects of the treatment last?
Wow, it's nice to hear that from a patient. It's very nice. Thank you for writing. So, well, what I have read is that I think that they don't know exactly for how long it can last. These changes in the body, so it could be something that lasts for some months, but it's something that. Yeah, it's not clarified till this moment. It's something that is not clear for how long can it last. Of course, that's why some patients ask about doing a PRP injection for the menopause symptoms, and since we don't know for how long it can last, and we actually think that it lasts for some months, yeah, it's something that it's not going to help in the menopausal women to improve these symptoms. But of course, yeah, I cannot answer precisely your questions, since I don't know for how long it will work. And again, thank you for this question, because it's really interesting to hear from a patient that has done it.
Of course, that's totally understandable. Again, thank you so much once more. And we will be finishing for today. And already I would like to thank everyone and each of you for joining us tonight for those brilliant questions indeed,
Yeah.
and definitely interesting ones. And of course, Dr. Anna, it's been a pleasure to have you, and there are plenty of thank yous coming up your way, of course. So once
Thank you
again,
all.
thank you very much. As you can see, thank you for a great webinar. I just want you to see some of those comments. Thank you for the presentation. I found it very, very useful. Thanks. And I'd like, oh, so yeah, I'd like that, as I'd like to remain reformed. Definitely very interesting. And
Thank you all
okay.
very much for your questions. Really, yeah. Mhm.
Oh, just sorry. I want you to see that someone actually has added great presentation, Dr. Anna, concerning the question about the further information, the topping trial that are currently running. Visit clinicaltrials.gov, PRP clinical trials.
Perfect.
So good to know. Thank you so much
Yeah.
for that.
Thank you very
It's
much. Thank you very much.
definitely
Yeah.
needed. So anyone, if you would like to just take a look and then find out, just go ahead and you can see it. I'm sure it will be useful for you. And once more, thank you, Dr. Anna. It's been a pleasure. It's definitely a topic that we could discuss for hours, and it wouldn't be enough. And I'm sure
Mhm.
that this is a topic that we will have more and more often, shortly, because as you've mentioned, it's still being researched, and I'm sure at some point we will have more and more evidence, and it will be a topic that we will be happy to present more and more for sure. Dr.
Yeah.
Anna, thank you so much.
Thank
And
you for inviting me. And yeah, thank you very much, everybody, for sending all your questions.
definitely, it's great to have you here all and being able to help you out, even if a bit, of course, with the questions and answers. And remember that this has been recorded, so you will be able to see it on myivfnswers.com. And if you are interested on that particular topic as well, there were some webinars on this topic as well. So I can only advise to just simply visit myivfnswers.com. There are videos or PRP from our previous presenters, so I can only encourage you to have a look at it. And of course, remember this webinar has will be also uploaded on our YouTube channel, so just go ahead and subscribe. That way you will be notified when the video is uploaded. And if you follow us on our Facebook or Instagram, you will be updated with all the upcoming events. As you know, we will be back here tomorrow, day after tomorrow, and so on. So I do hope to see you. Dr. Anna, thank you so much. And everyone, have a lovely evening, have a lovely day wherever you are. It's been a pleasure, Dr. Anna, to have you back with us here. And I do hope that we will be able to have more and more of those events coming up.
Thank you very much, Caroline. Good evening to everybody.
Thank you so much. Take care. Good night.
Bye.
Bye.
Good night.